Scalpel ready. Make the incision now.
Yes, doctor. Clamps ready.
Bovie to 20, suction ready.
For a cesarean section, spinal anesthesia is typically injected into the lower back at the L3, L4, or L4, L5 lumbar interspace. For a cesarean section, the surgical skin preparation is traditionally applied from the epigastrium just below the breasts, xiphoid process down to the mid-thigh, or knee level extending laterally to the flanks on both sides to ensure sterility. Then, a transverse incision is made just below the umbilicus, known as Pfannenstiel incision.
Here we are demonstrating the retraction and splitting of the muscles, localized strictly below the umbilicus.
Metzenbaum, carefully dissect the peritoneum layer. Watch the bladder reflection here. The Doyen retractor is carefully positioned to displace the bladder, ensuring a safe field.
During a cesarean section, surgeons use a surgical suction cannula to drain the amniotic fluid, opening parenthesis, liquor, closing parenthesis, dot from the uterine cavity. After opening the amniotic sac, this controlled drainage improves visualization and prevents excessive spillage into the abdominal cavity. The baby is then carefully lifted out. The umbilical cord is clamped and cut in between two clamps.
Okay, gentle traction, we have separation. Suction clearing the field now, doctor. Good. Keep an eye on the blood loss.
Then, uterus is closed with catgut 2/0, and second layer is closed with catgut 1/0. Muscles are approximated, and fat is stitched with Vicryl 1/0.
The approximation looks good. Let's proceed with the skin staples.
Skin staples, or silk or proline suture, is used to close skin.